Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a new patient. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, I'm Dr. Lee. What is your name?
Hi, Dr. Lee. My name is Sarah.
Nice to meet you, Sarah. How old are you?
I'm 28 years old.
Can you tell me why you came to the hospital today?
Yes, I've been experiencing redness and flushing on my face for the past few weeks. It's gotten worse over time, and now my face feels hot and itchy.
Thank you for letting me know. Do you have any past medical history?
Yes, I have a history of high blood pressure and asthma.
Okay, and is there any family history of illness that you are aware of?
Yes, my mother has high blood pressure and my grandmother had rheumatoid arthritis.
Thank you for that information. Can you tell me about your social history?
I don't smoke or drink, but I do spend a lot of time outside in the sun.
Okay, thank you. Do you have any allergies to medications or anything else?
No, I don't.
Alright, I'm going to perform a physical examination now. I'm going to take your temperature, blood pressure, and check your pulse and breathing. Your temperature is normal, blood pressure is 120/80 mmHg, pulse is 80 beats per minute, and breathing rate is 16 breaths per minute. Based on your symptoms and physical exam, I suspect that you may have rosacea. This is a skin condition that causes redness and flushing on the face. We will need to do some investigations to confirm this, such as a skin biopsy. In the meantime, we will start you on medication to manage the symptoms. You will need to apply a topical cream to the affected areas twice a day. In terms of nursing management, we will need to monitor your skin closely and make sure that you are using the medication as directed. You will need to avoid triggers that can make your symptoms worse, such as sunlight, hot and spicy foods, and alcohol. We will keep you in the hospital for a few days to monitor your response to the medication and make sure that your symptoms are improving. Once you are feeling better, we can discuss a discharge plan and any follow-up appointments that you may need. I will prescribe the medication for you now. Please use it as directed and let the nursing staff know if you experience any side effects. Is there anything else that you would like to ask, Sarah?
Yes, Dr. Lee. Can you tell me more about rosacea? What causes it and how is it treated?
Sure, Sarah. Rosacea is a chronic skin condition that causes redness, flushing, and bumps or pimples on the face. It tends to affect people with fair skin and typically begins in middle age. The exact cause of rosacea is not fully understood, but it is believed to be related to genetics, environmental factors, and a malfunction in the immune system. It can also be triggered by certain foods, beverages, and activities, such as spicy foods, hot beverages, alcohol, stress, and sunlight. As for treatment, there is no cure for rosacea, but the symptoms can be managed with medication and lifestyle changes. The medication that I have prescribed for you is a topical cream that reduces inflammation and redness. There are also oral antibiotics that can be used to control symptoms, as well as laser and light therapy for more severe cases. In terms of lifestyle changes, it is important to avoid triggers that can worsen your symptoms, as I mentioned earlier. You can also use gentle skin care products and sunscreen to protect your skin from further damage.
That makes sense, Dr. Lee. How long will I need to take the medication, and are there any side effects that I should be aware of?
You will need to use the medication for as long as your symptoms persist, and we will monitor your progress to see if any adjustments need to be made. As for side effects, the most common ones include itching, burning, and dryness of the skin. However, these side effects are usually mild and go away on their own. If you experience any severe side effects or have concerns about your medication, please let the nursing staff know right away so that we can make any necessary adjustments.
Okay, thank you for explaining that. What happens if my symptoms don't improve with medication?
If your symptoms do not improve with medication, we may need to consider other treatment options, such as oral antibiotics or laser therapy. We will also continue to monitor your skin and make any necessary adjustments to your treatment plan. It is important to note that rosacea is a chronic condition, and there may be periods of flare-ups and remission. However, with proper treatment and lifestyle changes, we can manage your symptoms and improve your quality of life.
Thank you, Dr. Lee. That makes me feel more hopeful about managing my symptoms. Can you tell me more about what I should expect during my hospital stay?
Of course, Sarah. During your hospital stay, we will monitor your symptoms and make sure that you are responding well to the medication. We will also monitor your vital signs, such as your blood pressure, pulse, and breathing rate. You will need to avoid triggers that can worsen your symptoms, such as sunlight and spicy foods. You can also expect to receive regular skin care to help soothe and protect your skin. We will also provide you with information on how to manage your symptoms at home, such as how to apply your medication and what to do if your symptoms worsen. We will also schedule any necessary follow-up appointments and provide you with a discharge plan when you are ready to go home.
Now, look at the notes for Extract 2. Extract 2. Questions 13 to 24. You hear a consultation in GP's office. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, what's your name?
My name is Jane.
Hi Jane, how old are you?
I'm 32 years old.
What brings you to the hospital today?
I've been feeling extremely fatigued and have had frequent headaches and fever for the past few weeks. I also noticed some unusual bruising on my body.
Have you had any previous medical conditions or surgeries?
I had a history of asthma when I was younger, but nothing major since then.
How about your family history? Do you have any family members who have had any serious illnesses?
Yes, my father was diagnosed with colon cancer a few years ago, and my maternal aunt had breast cancer.
All right. And do you have any allergies that I should know about?
No, I don't have any allergies.
All right, let me take your vital signs. Your blood pressure is a bit high at 140 over 90 millimeters of mercury, and your heart rate is elevated at 100 ppm. I'll order some blood tests and a bone marrow biopsy to investigate your symptoms further. It's possible that you may have acute lymphoblastic leukemia, or a type of blood cancer. We'll need to admit you to the hospital for further management and treatment. I'll have a nurse give you some medication to help manage your symptoms and we'll get started with the necessary investigations and treatment right away.
Okay, thank you, doctor. Can you tell me more about acute lymphoblastic leukemia? I've never heard of it before.
Sure, acute lymphoblastic leukemia, or, is a type of blood cancer that affects the white blood cells, which are responsible for fighting infections. In all, the bone marrow produces too many immature white blood cells called lymphoblasts, which then accumulate in the blood and other organs. This can lead to symptoms such as fatigue, fever, headaches, and bruising, which are similar to the ones you've been experiencing.
That sounds serious. What are the treatment options for all?
The treatment for all depends on several factors, including the patient's age, overall health, and the type and stage of the cancer. Typically, treatment for all involves chemotherapy, which is a combination of drugs that kill the cancer cells. In some cases, radiation therapy may also be used. In addition, bone marrow or stem cell transplantation may be recommended for certain patients.
Is all curable? What is the prognosis?
The prognosis for all depends on several factors, including the patient's age, overall health, and the response to treatment. With appropriate treatment, many patients with all can achieve remission, which means that there are no signs of cancer in the body. In some cases, the cancer may come back, which is called relapse. However, with additional treatment, many patients can achieve remission again. In general, the prognosis for all has improved in recent years, and many patients can achieve long-term remission or even be cured.
That's good to hear. How long will I need to stay in the hospital?
The length of your hospital stay will depend on several factors, including your response to treatment and any complications that may arise. Typically, patients with all require a few weeks of intensive treatment in the hospital, followed by additional treatment as an outpatient. We will monitor your condition closely and keep you informed of your progress.
Okay, thank you for explaining everything to me, Doctor. I appreciate it.
You're welcome, Jane. We will do everything we can to help you through this difficult time. Please don't hesitate to ask if you have any other questions or concerns.